I say it all the time. You can be doing everything right and still feel like your body is falling apart. You're eating clean, lifting weights, taking your supplements, meditating, doing the work, and yet the hormonal changes of midlife still show up uninvited. Hot flashes, weight gain, night sweats, low libido, itchy skin. Check, check, check. But one of the most overlooked consequences of hormone loss, joint pain and bone degeneration. Did you know that more than 60% of women over 50 will develop osteoarthritis? And it doesn't wait until your golden years. Perimenopausal hormone shifts can start triggering joint breakdown long before menopause is officially here. Estrogen plays a major role in maintaining cartilage and bone integrity. And when it drops, it's like the joints start aging overnight. So, whether you're prepping for a knee replacement, hip replacement, breast explant, facelift, hysterectomy, or you just want to feel strong, mobile, and resilient as you age, this episode is for you. I'm joined by my amazing friend and Menno bestie, Zora Benham. I always get your name, Benhamou? Benhamou.
We're besties and you can't say my
I
last
know.
name.
Every single episode I've ever done with you, I stumble on your last name. And I was even listening to you say it this morning on your podcast and being like, oh, yeah, I got that. Benhamou?
The H is silent. It's the H. Yeah,
It
that's always,
is. It's
it's
silent.
silent. Yeah.
Benhamou.
Yeah. Benhamou.
Benhamou. There we go, folks. Benhamou. She's a gerontologist, healthy aging coach, amazing podcaster of Hack My Age, and of course, a very, very great biohacker. She's here to share the ultimate pre and post surgery hacks for women over 40, plus her personal journey through a double hip replacement. You're going to want to take notes on this one because it's going to be packed with practical tools and aging wisdom. So, welcome, Benhamou, Mrs. Benhamou,
Call me Zora the Explorer. That's my
Zora
other
the
name.
Explorer. What's Zora short for again?
Zoriana.
Zoriana. Yeah,
Yeah,
that's
it's a Ukrainian name.
beautiful.
But in the US, we like to shorten everything. So it's Zora,
Zora.
right?
Yep. But either one is cute. Do you like your full name?
I think my first name is good enough. Like
Yeah.
that nobody can get the second name. You're not the only
No,
one.
no, like your full Zorina.
Oh,
Sorry,
Zoriana. It
Zoriana.
depends what language I'm speaking, because
Oh.
in Spanish, my name Zora is actually a bad word. So,
Oh, what does it mean?
it means whore.
Oh, I did not know that.
Yeah, I know it's
Oh.
embarrassing. So don't ever send me packages with my first name is Zora, because I always get these smirks from the mailman. And
Oh my gosh. I had no idea. Okay, so we don't go with your shortened named while you're in Spain.
yeah, exactly. Exactly. I have a friend named Penny, and that means penis. So when we go out together, it's like the worst. So she's
Oh,
Penelope. I'm
oh,
Zoriana, and she's Penelope. So
all right. Okay, Zoriana. All right, so I wanted to have you on the show because wow, have you been through a lot in the last year? And you have been very generous with sharing your story, which I think first and foremost, that has been so important. And you realized that once you started talking about it. So tell us how this has gone for you. What's been going on?
well, I was told years ago I have osteoarthritis. Didn't even know what that was at the time. And, I had started to have joint pain. I was in my 40s. Looking back, well, loss of hormones, but I didn't know that back then. I didn't even know what perimenopause was when I was in perimenopause.
Yeah.
So the years go by, and I said, well, I'm going to biohack this. And osteoarthritis, just so people know, it's not osteoporosis. These are two totally different diseases. Osteoporosis, like what you're probably thinking, is the reduction of bone density. Your bone gets like a sponge, becomes easy to have a fall and a fracture, and that over postmenopause or perimenopause with the loss of our hormones accelerates. So that's why we always want to be on top of our hormones and make sure our bones are strong. And of course, do a lot of other things to keep the bones dense and strong, but also flexible, right? We need to, I don't want to go on a whole other rant about bone density, so I'll cut it there. But that's what most people understand is osteoporosis.
Hmm. Hmm.
My bones are strong. My bones are no problem. It's the joints. Osteoarthritis is a degenerative disease. And that's where the joints, you imagine the cartilage is rubbing off. You're losing cartilage, you're losing that fluid in between, and the bones start rubbing against each other. And they rub, and then they start to build these little nodules as well. So then it becomes very, very painful. Your joints get stiff, you lose range of motion, you get swelling, and you feel like you're 80 years old. And I'm a gerontologist, so I mean, this is the very ageist side of me because not all 80-year-olds are like this, but this is what I was feeling. I thought, my gosh, I can't, I'm walking like many of the older adults that I'm seeing on the street who are 80 years old. I thought, that's not, I'm limping. This is not good. So I was usually able to hack it. I said, I'm a biohacker. I can hack this. I just took PRP injections where take your own blood, spin it in a centrifuge, re-inject it. Boom, I was back into action and it was helping me. And, or you do some certain massages. I was doing all my rehab exercises, opening the space. Of course, I have an anti-inflammatory diet. I'm pretty good with that. Sleep, stress management, doing everything I possibly could. And it was
And
working. Yeah, go ahead.
sorry, I just want to, because with osteoporosis, one of the best things you can do, of course, is lift weights and make sure that you're in shape and that you're not carrying a lot of weight. Is that the same when it comes to osteoarthritis? Like, can we help prevent it by being in shape and by lifting heavy things?
Well, when you lift heavy things, you get more pressure on the joint.
That's just what
So
I was
when
thinking.
you Google osteoarthritis, what can I do to prevent this or reverse this? The advice is lose some weight because obesity is this is the heavy weight that's on your joints. Now that wasn't my problem. I didn't want to lose any more weight. I was in very good
No.
shape. I had
Yeah.
muscles. I was
Like you're in
exercising.
such good shape, Zora. I just want everyone, if you've never seen Zora, the first time I even just saw a picture of her, I'm like, oh my gosh, this woman has the most kick-ass body I've ever seen, especially for a woman over 50. So shocking. Like she is super ripped and you definitely you didn't need to lose weight. You were doing the weights, you were lifting heavy things. So this was maybe
Mhm.
not necessarily
That
help.
wasn't my case.
Yeah.
So there's 12 risk factors for osteoarthritis, and these are I had 9 of them. So it was
Oh.
kind of set up for this. So the first one is age. Well, just getting older, you're more predisposed to this. Second is you're female, so you're also more predisposed to this. And when you lose your hormones and go through menopause, also increases your risk. So I had those. Plus, I had some genetic mutations that predisposes me to this, which I didn't know. I had injuries in the past in my 20s. And when you're athletic, I've always been very athletic. So when you're athletic, things happen and you have injuries. And so that also sets you up for disaster. And then I also am athletic. Being athletic itself is another risk factor, but being obese and sedentary also is a risk factor. So I didn't have that. I'm not a smoker, didn't have a job where I was lifting heavy things. So on the one hand, yeah, lifting heavy is great for the bones, but at the same time, if you are have this predisposition, probably not a good idea for you. But I
Mm.
had no idea, and I thought I was doing everything right. And you had a very interesting comment in one of our last episodes together, is that you questioned if perhaps my birth control had something to do this with this as well. And I thought that was really, really interesting because that messes up with your hormones, your natural hormones, and perhaps, yeah, that I didn't have the sort of anti-inflammatory effect of estrogen, or I don't know, maybe there was something else that happened to that. I never looked into that, but I thought it was a really interesting comment. Um, I don't know, but eventually I got to a point where I just couldn't walk anymore. And in general, I mean, when I started doing the research, osteoarthritis affects women more than men. And it affects, I can't remember, I know that it's about almost 7% of the global population. It's a lot of people. It's about over 500 million people in the world are affected by this. And there's plenty of people getting these surgeries. And I felt when I was getting to the point where I was considering surgery, because I was so anti-surgery, I just didn't want to go there. I didn't want somebody cutting my bone off and sticking an implant in there. It's just too invasive. But you feel like you're in this category of older adults that you're not quite ready to be in there yet. And no one could understand with the way I was leading my lifestyle how this could happen, but I had all these risk factors. So you do have a lot of self-pity and your mind starts to play tricks on you. And I noticed that when I got to the point where I was thinking very negatively, why me? Poor me. I can't go out with my friends. I can't go for a walk. I can't hardly travel. I can't even pick up a suitcase. You could feel that cortisol running through you. You know that those negative thoughts are having a negative impact on the body. And as gerontologists, we study the mind body connection. This is a very real thing. I went to a very research based university and I thought, wow, this is interesting. The mind body connection is a real thing. So that said, okay, I think there's going to be more benefits than risks for a surgery. And that's sort of when I decided I'm going to do this because I need my life back. But I really waited to the last moment. And there are surgeons and there are physios who tell you to wait until you just can't walk anymore. But I think that should be a real I think you should be really reconsidering that, or at least people have to make their choice. If you did wait and you were ready for that surgery a year ago, I think it's a pity to wait because what happens is
Mhm.
your gait starts to go off. You're not walking normally, and then you start to have back pain and shoulder pain and other issues because you're limping or you don't have a good gait. So, and then you have all these negative thoughts, and this is causing more inflammation in the body that you just don't need. So I think some people, for me, I needed to really get to the last leg because I felt that I just needed to try everything. I'm one of those people that when you go shopping, I may find that perfect dress on the right right when you enter the mall, and then I'm like, no, I got to go see if there's anything else
Oh,
better out
yeah,
there.
yeah, yeah,
Right? You done that?
yeah.
And then
Oh,
there's other
every
women
time.
who are like, no, I found the perfect dress. I'm just gonna get it right away.
Yeah.
Right?
Yeah. What are the chances of reversing osteoarthritis, especially like once it gets to the stage that you were at? Like, do we have a good likelihood of being able to reverse it, which is why they say to wait till the last minute kind of thing for the surgery?
Most doctors and surgeons would say no. And I only found one who said, yes, you can reverse that. And that's Dr. Elizabeth Yurth. And that's who I went to, of
Yes,
course.
yes. She's
And
amazing.
yeah, and so pentosan polysulfate was it's a drug that's originally used on racehorses, and now they have human trials, and they're showing great results. 80% of her clients have great results, including herself, who also has end stage osteoarthritis in her knees. Knees are much more common in terms of osteoarthritis than hips, but I believed it. I tried it, and I still would recommend it as something to try because if 80% it works. I just wasn't the lucky one, and that didn't work. But there's a lot of things that she threw at me, which I'm going to share as well. So I think there are people who can perhaps reverse, or at least you can delay. And I've been able to delay it for a good, I don't know, maybe 5 years or so. I was able to hack my way through it, thinking, okay, this is delaying. So perhaps I would have had a lot earlier if I didn't do all the things that I did. And I'd love to share some of those things as well.
Okay, but now that you've had the surgery, how much better are you feeling, or are you able to do the things that you weren't able to do? Like looking back, are you glad that you waited the 5 years? Or if somebody was in that position that you were in and is going to try to delay it, would you say like, maybe, maybe not? Like if it's inevitable either way, are you getting better quality of life by just simply getting that surgery done sooner than later?
Yes and no, I think. Yes
Okay.
and no. I think for me, I was one of those people that if I went in afraid, scared, not ready, I have another hack. Maybe I want to try stem cells, maybe I want to do something else. I would have been resistant, and I feel that my body would have maybe just not be prepared for it. I think you really need to be ready for it. And that being said, knowing what I know now, yeah, maybe I could have gone a little bit earlier. But I think I still needed to try with those things. But I would say if you're ready, if you feel like, okay, there's no point, it's inevitable. And I'm not going to try all the things because it costs a lot of money and it costs a lot of time.
I was
And the
gonna say,
only reason I stopped is because I ran out of time and I ran out of money. I
yeah,
couldn't do all the other things that I would like to. So I accepted it and said, okay, I'm just going to do this. I really have no choice. But I think if you are ready for it, and the amazing thing is that usually insurance covers this if you have private insurance, and that's what I have. And they didn't pay for my PRP and all
no,
my
you just
massages
go
and
to
all
the
my
clinic.
rehabs, and so you can imagine all the money that I've lost. But for me, I learned a lot. So that's why I have a lot of hacks to share. I think, well, let me just try to leverage at least what I've spent and share it with other people, what they can and cannot try, or they can try, or at least what they shouldn't waste their time on in terms of relieving pain and extending that a little bit. But if you're the kind of person who says, I think it's inevitable and it's just, there's no point in waiting because you're just going to do more damage, I think,
Mhm.
than good. But if you were like me, then yeah, I
I
got to
just,
be in that mindset. Just have to be ready to embrace it. And when I did decide, that mind just completely flipped. And I said, this is going to be the best
wow.
thing. I'm going to be bionic. I'm going to be superhuman.
Yeah,
I'm going
yeah,
to be
yeah.
better than ever before rather than worry, oh gosh, what if something went wrong? And what if I don't recover?
Right.
I
All the importance
that
of
out of your mind.
changing the mindset and going into it super positive, which I think is really, really important. And I think that sometimes we can just shoot ourselves in the foot, like us health freaks and health nuts. We will do everything else, not, trying to get the supplements, the alternative therapies, and spending so much money and time and energy dealing with all of these things, trying to deal with some issue before resorting to the surgery or to the medication. And I can relate with my migraines because I had 15 years of almost daily migraines. It was so debilitating. And I just watched my mental state go down farther and farther and farther. And it wasn't until I had a moment, and I'll never forget it. I'm driving in my car, I've got a migraine, and I actually said to myself, I don't think I can live like this anymore. And I
Oh,
wouldn't have ever done it. I mean, I got kids. I've got like I wouldn't have been able to take my own life. There's no way. However, just to even have that thought cross my mind was such an awakening and so awful for me that I was like, then go do something else about it. Go get on the medication, right? Because I
yeah.
had resisted because of the side effects of the medications that were available. I resisted for over a decade. And I
Mm.
finally gave in and I went to the doctor and got a prescription for a migraine medication that I take every day and I've been on it now for 2 years. And it gave me my life back.
I remember that episode that you made
Mhm.
where you shared your story, and it was so good. And I think it resonated with a lot of people. And I think you understand what it's like to live with chronic pain. Nobody can walk in your shoes unless they've understand what it's like. And no matter how positive you are, I'm a very positive person. There are
Yes.
times you just go, I can't live like this. This is not living at all, and it's not worth it.
Yeah.
And in the end, when I flipped the switch and changed the perspective, and people like, oh, I'm so sorry, you have to go. I'm like, no, I get to do surgery. This is a good thing, and it's fixable, it's solvable. But about all the people with diseases that don't have solutions for them, or they don't really know what it is, and this is the least of my worries. It is not a bad thing. And if you speak to anyone who's had any kind of a hip surgery, they are so excited for you because they know how you've
Yeah.
been living, and
Yeah.
they know how good and how quickly you recover and have such a different life because they've lived in those shoes. So most people, I would say, if you are contemplating about surgery and you're kind of leaning on the fence of doing it, go talk to somebody who's had it. And I've never met anybody who said it wasn't worth it.
It's
It's
neither have I. Like I was in body work. I did body work for 27 years, and I every single person I ever ran across, same with family members or people I knew that had a hip replacement or a knee replacement, they were every single one of them was like, "Oh my gosh!" Like instantaneous. You feel better, and it's just like, "Oh, thank
And
God."
that's how life should be. We shouldn't be
Yes.
so restricted. And what I started to talk about in social media and sharing, but I've shared my osteoarthritis story forever. Everybody, I knew there were women hanging on there thinking, oh, okay, let's see if this one works. And in the end, when I started to share more and more, I got so many messages of women saying, me too. Or I'm also
That's
dealing
what I
with
was
this
going to
joint
ask
pain,
you
or I've
about.
been told I have osteoarthritis, or I just got a hip surgery, and they're young and they're 40s or 50s. And and they're all quite athletic. So I found this whole world where people just like me, and I didn't feel so alone anymore. And which is why I'm so grateful that you're allowing me to talk on your platform about this, because if anyone woman is listening, I wish I would have heard that story when I was going through it. And that's why I'm so keen to share that it, even doing everything right and you're athletic or you're quote unquote young, and you it happens. It just happens, and it's okay. And if you are going to get the surgery, you're going to see it's life changing, and it's
Mhm.
absolutely worth it.
Yeah, I remembered. I mean, that's why I said it in the beginning there, where you were so surprised. I remember you telling me that months ago. You were like, I cannot believe the response I've been getting since I've been sharing my story. She's like, women are coming out of the woodwork just telling me, like, hey, that was me. I've had osteoarthritis since I was 35, since I was 40. Like, thank you for talking about this. And then all of the women that are in the place that you were in pre-surgery, which is, do I get the surgery or don't I? And if I do, how do I prepare for this in the best possible way? And
Mhm.
you being the biohacker that you are, you really have got it down to a science as far as like, here's what you absolutely have to do pre-surgery, no matter what surgery you're going in for, which I thought was, oh, just amazing. Um, so let's start at nutrition
Mhm.
being
Yes.
probably the foundation, the bottom level of that foundation. Not bottom as in the least important, as in the
Foundation.
that we're going to build on. Yeah. Because
Absolutely.
that's
Yeah.
because that was shocking. I heard what you said about your protein intake, and I'm like, oh my God,
It's
how
what?
much, how challenging that would be. So please, anybody that if you're going in for any surgery, and number one, actually, Zora, why why should we do this before any surgery?
Because you are cutting tissue, muscle, skin, ligaments, whatever it is. People have, it depends what surgery you're getting, but you need to repair and rebuild. And this is all made out of proteins. If you don't take in the protein, where's it going to come from? So you need to eat your protein or ingest it somehow. And that is critical to tissue regeneration. And there's other hacks that I'm going to share, but let's talk about building the tissue and repairing it, and that's protein. And if you are not eating, let's the basic the just in general, I always like to keep it simple: 1 gram of protein per pound of body weight or desired body weight. Let's just say that's the minimum. I doubled it. I even tripled it some days when I added essential amino acids, because I knew, and I was doing this even before and then during and then after the surgery. I mean, during me, I was in a hospital for 4 days. And then after this, when I came home, and I just kept building and kept trying to get, because one, you when you're at post surgery, you can't quite do the exercises in terms of rehab, even though I was so limited, so immobile. Well, I was doing just some basic mobility exercises, but it was better than nothing. And that's what I also want to stress is not only the nutrition, and we're talking about protein as well as anti-inflammatory foods, because if you keep adding fuel to the fire in terms of processed foods and things that are causing inflammation, it's not going to help you. So clean up your diet before this surgery. Make sure that you're getting enough protein and that you are getting in those antioxidants and anti-inflammatory foods. And then making sure that you move in any way that you can. Now, if you're getting, a facelift, that's one thing. Keep doing your exercises. You obviously need that and blood flow and all that. But if you're talking about a joint, you need to rebuild and repair. And the more muscle you have going into a surgery, the faster you'll be able to recover. And if you want to recover faster, then that means keep doing your rehab exercises, because I meet a lot of people who are saying, oh, well, I'll just do my exercises after. I'm in so much pain and I can't do it. I'm going to do it after. And I disagree. If you find a good physio, or you just even can go on YouTube, you can try to work within your limitations. And then there's, of course, things like blood flow restriction, where these bands that you put on your limbs. And I was so dependent on that on your arms or your legs, because that helps increase blood flow, but it also activates growth hormone when you're not even or barely moving. So I would have those on
Those are
every
the
single day.
katsu, is it called, or what's it
I
called?
was using the katsu bands,
Yeah,
yes.
katsu
The
band.
katsu is so what they do is they inflate for 30 seconds, deflate for 5 seconds. So inflate, deflate. So you're not feeling really, really restricted. Like it's not, completely, it's not completely cutting you off. You have a breather, and it's the cyclical motion that is quite key. So I was able to use those, and that helped. So it's kind of like if you were to, even with just general blood flow restriction bands, try to lift a baby weight, I don't know if a pound, a couple of pounds, it feels like you're lifting a truck, because you're partially restricting the blood flow. So you're tricking your body into thinking it's doing 100 burpees,
Mhm.
and you're just, sitting down from a chair. And that's why I love this. It's been quite the lifesaver for me. And I recommend it for people who are limited, really limited in their mobility, or even post surgery, where you're very much bedridden or very much sedentary. The research on blood flow restriction in general is so rich. There's so much information out there, and it's so positive. So they'll do studies on people who are in bed, not moving whatsoever, people who can lift a leg on the side of the bed, and then people who can actually do some squats or some exercise. And they all have been able to activate some growth hormone and build muscle. Obviously, some more than others, but it's even being sedentary with this type of. Don't do this on your own, by the way. Don't go and talk to somebody who can walk you through this, because there are some contraindications, especially if you're doing with just the traditional BFR bands. But this is something that I think, if you get the right guidance, it could be a real lifesaver during those moments. So you're very limited in mobility. So, but again, the muscle doesn't grow if you don't feed it. So that's where we got to get into that protein.
Right.
So exercise and nutrition, yeah, very key. There's other things as well.
And is there like, should we be dropping back on grains and things that maybe could be causing inflammation and brittle bones? Like, I know grains is sometimes a really bad one for that.
Yes, grains. I know, unfortunately, for people who like bread and muffins and
Yeah, yeah.
pizza, and it's better to try to get rid of that, or at least lower the consumption. And
Mhm.
you'll probably see a difference. You probably will feel better. I've worked with so many
Oh,
people who
yeah.
have had just general arthritis in their hands or their fingers. The moment we take out grains and sugar, are the two of the big ones, they just suddenly go, my gosh, I feel I have my fingers back. And those kinds of things, eggs and dairy, these are also can be inflammatory and triggers for some people. So you can play around with it. But again, just try, if you can't remove them completely, just lower the consumption, and then add in all those colorful vegetables and fruit, because that is healing. And I think once you fill up on that, and protein, protein is so filling, in the fiber from the vegetables is so filling, you'll probably be less tempted by the things that are causing inflammation. So I would really do that. And then there's some supplements as well that you can add into your diet for nutrient deficiencies.
Yeah. I always say too, like just even if you can do gluten free, like
Yeah.
if all you can do is remove the gluten even, a month before your surgery, it will drastically lower the inflammation, especially in the joints.
Yeah, maybe even avoid it. And get on those hormones, because the hormone therapy, I think, my problem was I've always been on baby dosages because I didn't have
Yes, let's talk
symptoms
about
that I
this.
was aware of,
Mhm.
right? And
Yeah.
it was quite silent. I was very asymptomatic. So every year I would check my hormones and I'm like, it's still nothing. It's still low. Like, why am I spending all this money on these hormones? Because I'm not absorbing them. But I would only find out a year later. So, because that's the only time I would test. And that was, I think, a mistake. So I think if any advice that I'd have for a woman right now is please go check your hormones, make sure that you're actually absorbing them, especially if you're asymptomatic. I mean, I really shouldn't have waited. I should have been testing all throughout the year.
Yeah, I think that's where a lot of women go wrong is they think that because they don't have those symptoms that are super common, which are hot flashes and night sweats, weight gain, vaginal dryness, brain fog. If you're not having those things, most women will think, I don't need HRT because I'm fine. I feel fine. And it's like, but can you
Or
feel your bones
yeah,
going?
yeah. Or they don't associate joint pain with
Right, right.
hormone loss. And I wasn't thinking that at the time when I had my one of my injuries. I had just an injury, and I thought, well, okay. And after a while, you think it's healing, but in fact, I never even. I just thought, oh, maybe it was because of the injury, and it was related to that for sure. But maybe it would have healed completely, or maybe if I had checked my hormones and topped them up, make sure that they were optimized, because I wouldn't have made that association.
Yeah, that's the other thing is HRT users will be told to use as little as possible to get rid of just a few of those naggly little symptoms. When the research shows us that it actually you have to have physiologic replacement of hormones to really get the benefits, especially for our joints and our bones. So
No.
it's about dosing.
Yes. If I only knew then what I know now. Maybe I could have either reversed it or just at least bought some more time. Like,
Yeah.
because when you get a hip replacement, you're not told how long it's going to last. And usually you get these hip replacements when you're 70. So then, oh, it'll last your whole life. But when you get them in your 50s or your 40s, well, I don't know. Some people, I've had doctors say it's good 10 years. I'm like, what? I'm gonna have to do this all over again when I'm 64? Like, forget it. Like, and then some doctors will say 20 years. And then some doctors will say, well, we don't really know because now we have new technology. Well, we know what worked with the old technology, but now we have new technology. So we're not really sure, but it should be for a good chunk of your life, or at least to the end. I don't know. Again, you just have to yeah, hope for the best. And I'm trying to preserve them. It's like having a new car. You don't want to have a new scratch. You just,
Yeah, yeah.
again, try to make them last as long as you can. And
So what do we know about the hormonal loss that speeds up osteoarthritis?
well, estrogen, as you know, is an anti-inflammatory, right? So if you've had an injury, let's say, and you didn't heal well, which I think that was probably part of my situation, is that you have this chronic low-grade inflammation that you're not quite aware of. And I'm one of these people who just push through any kind of pain, a little pain, whatever, not a big deal. It'll go away. And yeah, and that's that you don't pay, at least I wasn't paying attention so much to some of the little niggles that I think with the loss of that, certainly progesterone, we also know is really important for bone and bone health. And I think that's it. When you lose it, you don't have the bone remodeling. So we're talking about bone remodeling, but that's for the osteoporosis, but it all is
Yeah.
intertwined. So
Yes.
you need your cartilage to be in a good condition. You need to have the fluid there. You need the inflammation to go away. And having enough estrogen is key to that. So there's no doubt that if you look at the research, one of the risk factors is menopause, right?
Yeah.
It accelerates these kind of conditions.
Yeah.
And of course that's exactly what happened to me. My biohacks weren't working anymore
Mhm.
2 years ago.
Right. Yeah.
They were
And
working for
all
me
of
for
them
years.
help us make collagen. And even the estrogen,
Yeah.
I always say like it doesn't just lubricate your vagina, it'll lubricate your joints.
Yes.
Lubrication
Yeah,
everywhere.
absolutely. It's a lubricant. Yes, think about hydration because you're right, we talk about our skin a lot, but it is your joints. It is that fluid that we need in there. Like the dry vagina, dry eyes, dry ears, dry skin, and dry joints.
Mhm.
It's not isolated to just one body part.
Yeah, yeah. Like even frozen
Absolutely.
shoulder is from estrogen loss primarily. Like
Hmm.
there's so many
Yeah.
things with the musculoskeletal system that relies on hormones. And I think the big takeaway is be on top of it in perimenopause, which I always talk about, is timing, timing, timing. Like you don't wait until you've lost your bone and you're ready for surgery in your 50s post menopause to start replacing hormones. Our bones start going at a very younger age. Same with our collagen. We start losing collagen in our 20s, I do believe. So it's like stay on top of it, ladies. Stay on top of it. Collagen, is that something that you would recommend as far as
As
supplementing with?
taking a supplement?
Yeah.
Yes, yes. I think collagen is really important. I think it works. I think there's enough research out there. It's great for so many things, obviously your skin, but there is wonderful collagen supplements out there, and I think it's part of my daily habit. It didn't save me, but I think it's got to be part of the routine. Along with, I think essential amino acids is a good
I was going
one.
to ask you
And
about
we're
that.
talking about, yeah, the essential amino acids. You could take it as a supplement, I mean, a pill or a powder or whatever. I think that is key because it's really hard to eat a lot of protein, as it is
It
that
is
when
so
you need
hard.
to eat protein, just period. But when you're going into a surgery and you need to increase it, it's even harder. So I was relying heavily on essential amino acids because also when you don't move as much, I'm not as athletic as I used to be. The hunger isn't as strong, so it's harder to eat as much. Like the moment I'm able to go and do more sports and do things, then the hunger kicks in.
Mhm.
So yeah, being less mobile, and it's a natural thing. Your body says, well, you're not moving around so much, so I'm not going to turn on that the ghrelin, I guess, to
Yeah.
to make you more hungry. So but you know it's important. You got to force it in. And so you try your best. And then I top it up with essential amino acids. But collagen is one of those things. And I still take it anyways, for many, many other reasons.
Same.
And that's important. Yeah. And
Yeah.
creatine as well is another one great because
Yeah.
we're talking about bones, but our muscle has a huge effect on our bones as well, right? So the more muscle we have and the better quality, then obviously it's going to have an effect on bone and bone remodeling as well. So they do go hand in hand. So whatever I talk about bones, I also talk about muscle.
Yeah, and then the essential amino acids probably one of the things I recommend the most is for menopausal women, just for that reason, and perimenopause, but just to get that protein up because it's no calories. And
Yeah.
whey protein makes you kind of bloated, and it's just, and it doesn't
Mhm.
to me, it doesn't taste great. But the essential amino acids, they're just so easy to take. You just scoop that into the glass of water with your creatine, and you're good. And it's a good tasting drink. Like it's not.
Oh, well, that's if you get a good one, like the
Yes,
one
some
I'm
of them are
taking
really
on, and
bad.
it tastes fabulous. But up until I found that one, I
The
was like, this
Kion?
is tastes disgusting. I don't
Yeah, I
like
heard
taking it.
that. There's the Perfect Health ones, which I don't want to, like, they're really, really good product, and I do recommend them, but the taste is not nowhere near as good, I heard, as Kion Amino. So I always use Kion Aminos. Uh,
Yeah.
and
Those are ones, those are my favorite. It tastes so good. I actually wound up drinking more water.
yeah,
And you just sip it throughout the day. It was easy for me. I had it in the hospital when I
nice.
knew that I needed protein, but I wasn't hungry whatsoever after a surgery. It's not the first thing on my mind. And then and I took the other things I took before, during, and after was chlorella and spirulina. And I
Oh,
like the little energy bits because that's another thing that tastes like garbage. But when you have them in these little tiny bits, like aspirin size thing, you just swallow them and you don't even notice it. And that gave me the nutrition that I needed when I didn't feel like eating. And then it also the chlorella was the one that also gave I felt it was a good detoxifier. Wow, because I had so much antibiotics and medications and painkillers. I just said, give it all to me because obviously I don't want to feel pain. I don't want to be that. So you need to remove these things. So your body after a surgery needs detox. But I was taking the chlorella as well in the hopes that, okay, let's at least I should be doing something else for my body. And I found that those two are really easy to take to the hospital, and
Mhm.
especially right post surgery, you just kept going with it. Easy peasy.
Anything else that was pre-surgery, that supplement wise, that were super key?
I think just started taking urolithin A,
Hmm.
the Mitopure, right before the surgery, and that will help with bone strength. Okay, it's so I thought this is good. It was part of my stack, but I had a second surgery, so I had double hip surgery, but not at the same time. So I did one, and then 3 months later I did the other one, and I noticed that I had a quicker recovery with the second one, and I kept going with urolithin A. So by then I had been on urolithin A for 3 months.
Ah,
So it's just like with any supplement, that most supplements, it takes time to kick in, or you don't, at least with stuff like that, you don't feel it right away. And I had a feeling that, and that's something I still take,
yeah.
because it's also great for inflammation, and there was a third one.
It's actually a really good polyphenol and acts as a phytoestrogen. So there's been some research done on breast cancer and how it has helped like reduce breast cancer risk, I think it was, or inflammation in the breast. I can't remember what it was, but that it helped somehow with breast cancer.
Oh, interesting.
I
Yeah,
have to
because I
get
could see.
there's just one study, so it's not a lot, but I've heard our friend Dr. Felice Gersh talk a lot about it and how
Oh,
she's like,
interesting.
this is such a great polyphenol and it's so great to help you metabolize your estrogen. And then on top of that, the research showed that people that were taking urolithin A that were sedentary had muscle growth. They didn't change
Oh,
their
muscle
fitness
growth?
at
Because I thought it
all.
was the strength. Yeah, because they're usually, I think they promote that on the studies that show muscle strength, but I didn't realize that it had muscle growth as
I thought it was
well.
muscle
Interesting.
growth. I'll have to,
Yeah.
well, I'll
But
have to
it's
look.
also, there was an interesting study that was done on urolithin A that showed how positive benefits for people with osteoarthritis, but I
Ah,
didn't find it early enough. But if
okay.
anybody's got osteoarthritis now, go check that out. You can Google it and you'll find the research on urolithin A and osteoarthritis, and it was pretty good.
I think it's safe to say timeline, urolithin A, it
Yeah.
hits on many different things. Let's just put it that way, that it's good for you, it's good for your gut, it's good for your muscles,
Mitochondria. Yeah.
mitochondria function, and for estrogen metabolism.
Yeah, I didn't know that about the estrogen. That's really cool.
Yeah.
The other supplement I would recommend people to take is a good bone supplement,
Okay.
because your bones, if you're getting, if you're cutting through bone, for example, for a knee or a hip or something like that, because your bone, if it's a hip implant, your bone needs to grow around this implant. And you need to support that with, I think hormones are really important, but also a good supplement that has some calcium, magnesium, vitamin D3 and K2, some
Mhm.
boron, getting good minerals as well. Like from Beam, for example, is another good one. But I think those are kind of key supplements to have before and after as well. So, but before you go into the surgery, you probably want to stop your omegas because that's a blood thinner.
Both blood thinner. Yes. Yes. Exactly. I forgot about that. What about people, because of our industry that we're in, or fasting? Like we couldn't get in 200 grams of protein a day if we're intermittent fasting.
Yeah.
So what would you recommend as far as like, do we want to be doing some fasting just to get that, the autophagy and cellular health happening pre-surgery, or is that too much of a stress and not recommended pre-surgery?
Well, right before the surgery, you have to be in a fasted state.
Yes.
So
Yes.
your doctor will ask you to do that anyways.
Yeah.
But In terms of fasting, I've tried that because there is some research showing that fasting can release some stem cells, right? Your own natural stem cells. It's something you can play around with. I think before the surgery, if you are or if you're not really into, if you have osteoarthritis and you want to try to see if that works. I tried it, didn't work for me, but maybe I didn't fast long enough. I'm not a fan of fasting, just myself, because I know my body is needs it, and I work with too many women who are just eating too little and working out too hard, and they hear about intermittent fasting, and I think there's a time and place to do it,
Yeah.
and I think a good fast, a couple of times a year, sort of clean up the cells, fine. But I wouldn't be doing this day in and day out, because at least the women I'm seeing, it's like they're struggling with their body composition and they're like, why can't I lose the weight? I'm eating nothing. I'm exercising too much. And so it's because I see that they're just not getting enough food. They're not getting enough calories. They're not getting enough protein. And it's just not working for women our age. And that's where I'm not into it. But I would say post surgery, no, not right after. You're in a building mode. Maybe if you're not feeling so, if you're a bit woozy right after the surgery, you just can't fit the food in, like that's okay. I think there's two camps, people who are like, just let your body fast. That's fine. 24 hours. You don't feel hungry, listen to your body, and that's okay too. And then there's other people like me who was like, okay, I don't feel like eating, so I'll take my energy bits and I'll drink my essential amino acids. And that's I felt like, oh, I got something. And I did have bone broth with me as well. I brought that to the hospital. So I've been doing that before and after as well. So if you can drink bone broth, great for collagen, great for your tissues, and easy to take, easy to ingest, especially if you're not that hungry. You're getting a little bit of that in, but maybe, I mean, you could consider a fast. I don't know the research on fasting post surgery, like how long you want to wait, but I wouldn't do it right after.
No.
I think your body's just in too much of a stress,
Mhm.
and it doesn't. My period stopped during both surgeries, and it was your body's in a complete stressful mode, and I wasn't expecting it. I wasn't sure because I was supposed to get my period like right during the surgery, so I was like taking my progesterone extra long because I didn't want to come, but it didn't come anyways. It took me 3 months, and then I got a period, and then went into the other surgery again, and then 3 months later it came back. So it
So
was.
that just shows just how much stress your body was experiencing, even with doing everything right. Like this is still a stressor, and you have to see it like that. So piling on intermittent fasting or long fasts, you're just piling on stress to the system. And that this is
Yeah,
not the time to be doing this. This is time to be healing and feeding the system, not taking away from it and stressing it out any farther. Because you losing your
exactly.
period, yeah, that's a sign that your body was, you know, it's like, nope, now's not the time to be fertile. We're in recovery. It'd be interesting to have seen what your reverse T3 was doing at this time.
Oh, I don't know. I don't know. I didn't test it. I tested my thyroid in between surgeries, but not the reverse, because that was a really hard one to find in Spain. We don't get
Oh,
those
yeah, it's
easily.
impossible to find in Canada too. We don't even have
Yeah.
a lab that tests for it. They have to send it to California, which is ridiculous. Yeah, in Canada,
Crazy.
like, come on.
It's
But
ridiculous.
what about peptides? Because peptides are used often pre and post surgery. So, did you take peptides?
Well, I did take peptides, but I took them after the first surgery, and then and I took a break, and then I took it again after the front. But they're expensive. So if I had the choice, I probably would have done it before and after.
Yeah.
But it was the first time I've done some peptides for healing and regeneration. And so it was recommended to me. So a lot of these things that we're talking about have been recommended to me by some of our most brilliant guests on the podcast who are regenerative medicine specialists and biohackers and are in this space, who orthopedics who really want to prepare me well. That's why I'm here sharing it with you, because I think it's such vital information that every doctor should be recommending their patients, but they don't. And so, we're discussed already the supplements and nutrition and the exercise. We didn't cover sleep and stress, but I think that is a huge piece as well. But but just kind of just completely lost track what I was going to say. Darn it.
But that you're
Uh,
right, because the sleep and the stress are two big things, which
yes.
peptides and hormones and everything, and the nutrition piece, all of those things can help with your sleep and your stress too, which is
Yes.
important. But
Yes.
um,
But the peptides that I have been recommended to me are BPC 157, that's body protective compound BPC 157, and TB 500. T is in Tom, B is in beta. 500. It's also called thymosin beta 4. And these are both go hand in hand very often when you're trying to heal or recover from some damage. But BPC 157 is also very well known for its protection of the gut. People who have gut issues are very often recommended to take it. And when we talk about peptides, there's a whole world out there in terms of there's oral and sublingual and injectable. In my case, because I had a major surgery, I had to get the injectable. And I believe me, I tried to talk my way out of it. I don't like injecting myself. I thought
oh,
I could do something else. Um, and yeah, but
such a
I had
pincushion now. I just like needles is just so not a big deal. But
Yeah, I know. I know. You get used to it. You get
yeah,
used to it, but I try to talk my way out of it. So no, you need the big guns when you're going into a surgery like this.
okay.
So you definitely want to work with a practitioner, somebody who knows and understands this. I don't know, Karen, if you walk people through BPC and TB 500 at all. Is that something?
I've
I
talked
know
about
you're
it
not
on
in
the
the weight loss
podcast.
peptides.
Yeah, I've talked to them about the on the podcast before, uh, a couple different times. I've of course had Natalie on
Yeah, yeah.
times, to talk about it. So, and then our group, we have a peptide group, and we share a ton of information about all different peptides, not just the weight loss peptides. So, BPC 157, you used to be able to get through prescription, and they have actually removed that now. So you can't get it from a pharmacy anymore, but you can get it from third party websites that have like for research purposes only,
Mhm.
which that is on the consumer, right? We can't take any responsibility for what they purchase online, but we can teach people about it because I think that it is essential. I think these peptides are just game changers when it comes to this sort of thing, especially when it comes to pre and post surgery. I have heard so many people say that they swear by the BPC 157 for pre and post surgery.
Yeah. Yeah.
And
And it's quite a safe compound. I mean,
yeah,
it's
I think it's
something.
the most popular one.
Yeah, so what it was told to me to use it, I was she was like, okay, you just take it. You can take it as long as you like. Like there wasn't a restriction. Other peptides are no, it's only a 4 week protocol or a 6 week protocol, but it seems like a lot of people that I've interviewed as well, they're quite liberal with the BPC-127. It doesn't mean anybody just go and buy this online and start injecting yourself. Obviously, work with somebody who understands what your situation is and guide you through it. But I think for me, the BPC 157 was a game changer. But I noticed I had only the BPC 157 with the first surgery. And then with the second surgery, I added the TB 500. And again, noticed an uptick. Had been taking urolithin A already by 3 months. So it's kind of hard to tease out, was it the urolithin A? Was it the TB 500? Maybe it was just combination. But when you look at people who are getting through surgeries and recommended peptides, very often they'll recommend the two at the same time. I only took one because I'd never taken BPC 157. I was a little scared. I want to start, if I had a reaction, would it be TB 500 or would it be the BPC? Like I didn't know. So I felt like I'm going to do experiment one and then experiment two.
Mhm.
And everything was brilliant, no problems either one, but I felt like I needed to go slowly because it was a new thing for me. But I do think that was really key. I would really recommend people to go and dig a little deeper into what that is, or ask you about it and talk to you or work with you in your group, because it is something that I think it's vital for repair, regeneration, angiogenesis. If you are going and getting a surgery, you're probably getting medication, antibiotics. You want to protect that gut as well. So you're getting a lot of benefits, anti-inflammatories. There's so many things that these peptides do,
Mhm.
but outside of what they are, what they're known for, like the BPC, but you get tons of benefits. Just do a little bit of research and you're going to find some pretty cool stuff. But
Yeah.
those are those are two peptides that I took that I think were really good. And there's a couple other things that were awesome as well.
Like,
Okay. Like, okay. So there was one thing, I think you're familiar with this, but I didn't get a hold of it because I couldn't find it in Spain.
oh,
And it's nandrolone decant, and it's a steroid.
really, Zora? I am
Yes.
shocked to hear you say that.
Yeah.
And I'm so
Yeah.
happy
So
that you did because I think that there is a necessity for use of anabolic steroids in menopausal women. And nandrolone is one of the best ones.
yeah.
Yeah,
And so this one is gone. I mean, steroids in general got a bad rap for just being steroids, right?
been
But
abused.
when used, at least in this case, for my situation, it was recommended because they said, well, if it's a low dose and for a short period of time, it can do some miracles.
Did
And I would
doctors
have
ever tell you to do this?
absolutely, it's the Boulder Longevity
Yes.
Institute. I was working with
Okay,
her
so
team.
anyone that doesn't know Dr. Elizabeth Yurth, she's me and one of Zora and I's absolute favorite practitioners. She's super brilliant. She's so smart about peptides and she's an osteo doctor,
Yeah, she's regenerative medicine, anti-aging, you say, but she's an orthopedic.
orthopedic.
I don't think she's a surgeon, but I think she's in orthopedics.
Okay. Yes. She's so
Yeah.
smart. I have to have her back on the show.
She's brilliant. I really like her. I think she's very, yeah, gotta get her on the show again. She's very unbiased in a lot of things. Over the years, I was told I had to need to have surgery, and I was, haha, no way, not me. And when I talked to her, I knew that she wasn't anti-surgery,
Mhm.
but she was going to do everything possible to try to avoid it. And if she said, I need surgery, then I would go, yes, okay, I'm ready for it. Because I've just believed her rather than a surgeon. You go, well, I don't know. Does he just want more money? He wants to do another surgeon or surgery, or you have these
Yeah.
doubts. Of
Yeah.
course, they want their money. And maybe it's not that, maybe, but that's what I had in my head. So that's why I thought, oh, I felt she was very unbiased
Mhm.
and would let me know. And well, it wasn't exactly her, it was her team I worked with at Boulder Longevity. And I trusted the team. They knew me very well. And it got to a point they were like, yeah, it's time for you to go. I was like, okay, I'm ready.
Oh, so she talked about it a little bit on my interview with her. She did go into anabolic steroids, and I knew that she was open to them.
Yeah.
And I wanted her to talk about them because I have used them for different things in my practice as well as like just with my own self. And so nandrolone is one of the ones that is legal in the United States to be prescribed. A lot of them aren't legal, but nandrolone and oxandrolone are both two that you can get prescribed. And in the right dosage, it can be very beneficial to bone health
Mm-hmm.
and
Yeah.
muscle
And
loss
muscle. Yeah.
because it can help you maintain. And that's where they first came on the scene in the medical world was for burn patients and AIDS patients with
Oh,
wasting, like right, the muscle wasting to help preserve muscle tissue in AIDS patients and burn patients.
how cool. How amazing. Yeah, there's so many ways, there's so many things that you can use, I guess, off label, guided by a doctor or by a practitioner who knows what they're doing that you would have never thought of. And of course, your doctor's not going to tell you about these things. My surgeon didn't say anything, didn't even say anything about building muscle or eating right or which supplements to take or not to take. I just got it from someone else. And I
Mhm.
think it's a pity because this is just something that's where we have to become our own advocates, and that's why hopefully that's if you're listening right now, you're doing the work. You're writing your notes and you're going to do your research and then speak to your surgeon or your doctor. And I had a whole list of supplements that I brought to my surgeon. And I was like, can I take this? And he's like, I guess. Okay. I don't know. It's like, seems all right. It's like he just didn't, it wasn't his jam. So he probably was scanning maybe for something and didn't find it and okay with it. But yeah, nothing like that. So that's why we're here today to share that. There's
Yeah.
another one that I
Yeah.
didn't get a hold of that I thought was really cool and I would have tried. It's called cerebrolysin and it's
Oh,
an
yeah.
IV drip and it's a neuropeptide and that
Yeah.
helps with the nerve healing. It reduces the inflammation. And when you think about your brain is also taking a hit with all these drugs that you're on. And
Interesting.
Yes, it's one thing. I think I can't remember the exact dosage that was recommended, but again, everybody's individual and have to get their own recommendations. But it was a short-term thing. You go in several times with this
Yes.
drip, and then you're kind of in the clear. So
That
yeah.
one, yeah, that one very challenging to get
Uh-huh.
because it has to be done via ideally through IV. And so it's not one of the peptides that you can purchase and then just inject yourself with. It's better
Yeah.
to do a series of IVs. I think they say like you do 5 days or 2 weeks worth, 5 days a week, 2 days off, or something like that. And you can, I, I, number one, I would never have ever not have thought that they would recommend that for post surgery. But that makes sense to me now that you say it. But yeah, that's surprising to me.
Yeah.
I interviewed Dr. Kirk Parsley. Have you ever had him on your show? He's
No.
a SEAL doctor.
The what doctor?
He's a Navy SEAL doctor. So he's a Navy SEAL.
Oh,
He's
yes.
an
Yes.
ex-Navy SEAL himself. And then now he's
Yes.
a doctor for Navy SEALs.
Yeah. Yeah.
And so he's trained in, PTSD, and he's trained in psychedelics and using psychedelics to help with PTSD and
Hmm.
inflammation of the brain. And he was the one that taught me that number one, mushrooms, psychedelic mushrooms, will drop one dose, a heavy dose, will drop brain inflammation for 3 months. And I was like, okay, well, not everyone wants to get high. So is there an alternative? And it was cerebrolysin, which worked even better. He said, you use cerebrolysin, and he said that drops brain inflammation for like a year. A
Wow.
year. I was
I
like, so he said post concussion, PTSD, anything, any sort of brain trauma at all. That's the one. That and then the lesser ones that were still effective was Selank and Semax, which are
Yes.
two peptides that you can purchase. They come in a nasal spray or an injectable. So there you go.
Oh.
Isn't that crazy? But then I tried to go find it because I wanted to get the cerebrolysin. And I was asking my naturopath, like, could you get this? And she's like, oh my gosh, I have no idea if I could get this.
Uh,
Like, it's
yeah, it
really
seems like you need
hard
to
to
go to a
find.
clinic
Yeah.
who
In
understands
the
these
States,
things.
probably. Yeah.
Yeah.
I'll go down
Uh,
and see Dr. Parsley maybe for it.
yeah.
He was
Exactly.
fascinating, actually. He was like one of my favorite people to interview. He's a really great speaker. So, anyways,
Oh, introduce me. Yeah,
yeah,
let's get him on the podcast because he
yeah.
sounds really cool. There's one other thing that I think
Okay.
was something that's easy peasy for people to do is methylene blue. And this
Ooh,
is
my favorite.
that you've probably seen biohackers with their tongue all blue and it's actually was I think it was the first drug that
It
was ever
was.
invented in the world.
Yeah. In the
It was originally
1800s.
yeah, something. Yeah, it was really late 1800s, and it was originally a textile dye, and then they found that it could cure some infectious diseases.
Syphilis or something.
Yeah,
Yeah, yeah.
yeah, and it's actually I spoke to a nurse recently, and she says, "Oh, we still use this in the hospital as an antidote for cyanide poisoning."
Yes.
And I thought, oh, it's interesting, and carbon monoxide
Carbon
poisoning.
monoxide poisoning. Yeah.
Yeah, and I thought that was really interesting. So it's still used today. You can just get this stuff online, and it's one of these things. Again, I think you need to talk to somebody who understands how much you should take and what's your situation because it depends on what you need it for. But I took it because it helps with the mitochondria. It's an antifungal, an antiviral. It's neuroprotective. It reduces oxidative stress. It helps you with your energy, your mood, and things like that. So I think it's the only thing is that if you are on SSRIs, and there are some contraindications, so read those first before you get into this. But it's been such a easy thing to take. For me, I take it as drops just on the back of my tongue. It's not, I don't have to inject myself. I don't have to do some crazy things. It was something I took every single day. And I figured, okay, yeah, it's just an add on. I didn't feel the energy that a lot of people feel. I already have quite a bit of energy. And I know so I didn't notice that, but most people say that's what the one thing that they do feel. But I figured I'm in a hospital. Anything antifungal, antiviral is probably something I need anyways. And it's simple. I could get it online, and it was really a hack that I think that people should just consider.
There's a couple people that have come on Rogan's podcast talking about methylene blue. One of them being Mel Gibson, saying that he knew of, I think he had like two or three friends who cured their cancer. And, don't go following this as advice, anybody, please and thank you. But they used a combination of ivermectin, hydrochloroquine, and methylene blue too, and they are now cancer free. And then he had another guy that came on who had brain, and he was a brain doctor himself or brain surgeon or something like this. Like this is what he did for a living. And he got a brain issue where he was getting multiple seizures a day. And I heard him talking about this on a methylene blue ad. And so they showed a clip of him talking to Joe Rogan and he's saying like, I
Yeah.
started using methylene blue and I was having multiple seizures a day and they disappeared.
Unbelievable.
Right? I'm like,
But did you know there was this is totally off topic, but I didn't want to forget is because you said seizures, and there are people who have migraines and they also had seizures, which
yes.
I don't think you had, right?
No.
I don't think you're one of that camp. Did you hear that episode I did with Dr. Angela Stanton on salt as being
You
a
interviewed Angela Stanton? Stanton?
yes, yes.
What?
Did you ever try that
I
path?
I have her book. Her protocol is so hard.
What? I thought it was just taking salt. I mean, I know she's got this
Uh,
whole other, she didn't go into the
it is.
details.
Oh my God. I followed her for years. I tried to do like a modified version of it because she has great success with
I
my,
had, yeah, I have somebody in my community who singing her praises, saying the salt helped cured her migraines. So you got in the interview. So I hunted her down because of this person in my community,
yeah.
and definitely worked for her. And it was really quite simple as salt, I think is what she was saying.
Yeah, I tried just adding salt and doing kind of their protocol with just the salt piece, but their thing is, and I'll just quickly explain this for anybody that has migraines, and definitely go check it out because I do think that they've helped thousands of people. You have to have a almost 1-to-1 ratio. I think it's a little bit more salt to potassium, so it's like but close to a 1-to-1 ratio of sodium to potassium with every single thing you eat.
Oh,
So
that's
you have
hard.
to know exactly what the amount of sodium is and potassium is in every single meal that you make for yourself.
Okay, you got to weigh, measure, and try to figure that out. That's really hard.
So I was like, and I'm not that person. I'm not regiment like that. It's really, really hard for me to be like that. And you would think, if you want to get rid of your migraines bad enough, that you'd be willing to try it. And I tried to do like I said, a modified version to try and do like a lazy version of it. And it didn't do anything for the migraines. And so I'm like, ah. But they do have a recommendation. And plus, it's very strict, like first carnivore and then very strict, it's keto. You got to be keto. And then
Mhm.
you have to have this exact ratio of sodium to potassium. And then there's times where you need to increase it right before your period. And if you're going traveling or if you're going on an airplane, then you have
Mhm.
to adjust and you have to have more sodium in certain times. Full moon, it changes as well. So it was like it's like a full-time job, Zora. So, anyways,
Yeah.
I will
They,
listen to
yeah.
that. I would love to listen to the episode though, because I thought many times of having her on the podcast. I found she's quite quirky, like just my
Yeah, a little quirky, but
yeah.
she's got the science behind her. Like
She is. Yeah.
she explains quite, I mean, it's quite convincing. And I'm just waiting for somebody to send me an email saying it totally worked for them. Happy, thank you for sharing that. I haven't yet had that other than one in my community, but I think this is going to help so many people. I don't have migraines, so but I'm willing to share it with anyone who does. Like you said, when you got it, you'll try anything. You're in so much pain, you'll give it a go. So it's just a rabbit hole for some people to go down, I
Yeah.
think, to at
Yeah.
least
Yeah.
try.
Yeah. All right. So let's recap just quickly here. We understand nutrition has to come first. We need to prioritize our protein up to 200, even 300 grams of protein a day pre-surgery and post-surgery for repair. I think that that's super key. Uh, Essential amino acids. We love Kion. A little hack that for you too on the Kion aminos is mixing a half pack of element electrolytes.
Electrolytes.
Tastes so good with Kion mixed in with
Oh,
Kion.
I haven't
Yeah,
tried that.
really good.
Mm.
Like the lime element with the berry Kion. It's
Ooh.
so great. And just half pack, I find. I don't need the whole pack. Uh, Urolithin A. What else did you say there? Oh, and then I liked that the chlorella and the spirulina
Yeah.
for
The
high
energy bits.
nutrients. Yep,
Yeah.
energy bits. Post surgery, and then peptides, BPC 157, TB 500, or thymus, or no, TB 400, right? Is the
TB5, no, it's TB500 or thymosin beta 4. The difference
thymosin
is one is
94. Yeah,
synthetic and
one
one
synthetic.
is
Right.
natural. Synthetic is cheaper and it actually is more targeted, whereas
I've
TB5
heard that.
thymosin beta 4 is actually more broad and a
Yes.
little bit more expensive.
Yeah. Awesome. Okay. Collagen.
Hmm.
Just anything to get the protein up. No fasting. Hormones. Make sure you have optimal levels of hormones, not just you're replacing at minimal dose. We want optimal levels of hormones in your body. That is so important for repair, for mitochondria, for bone health, for joint pain, everything. And that's going to help pre and post. Super, super important. What am I missing here? Oh,
Also about, I would say anything that you can do to detox. So we talked a little bit about the chlorella,
yeah.
but if you have things like glutathione, anything with zeolites or bentonite clay, I was taking the Push Catch by Quicksilver. I don't know
Mhm.
if you know that one. They have some of these
Yep.
called Ultra Binder
It's
and liver
definitely got one
sauce.
of the best detox lines. Them and
Yeah.
Cellcore, I find are the best.
Yeah, yeah, I think that was anything like that because again, you're pumped full of medicine and antibiotics. And yes, take them. I took them. This is not the time to try to be natural,
Right.
at least for me. I didn't want to be pain. I didn't want to have any kind of infection. So I just did what the doctor said, and knowing, oh, we can just detox later. So
Yeah.
anything with a detox is something also really good to have.
Yeah, yeah. And gentle detox. I don't think you should be doing like a hardcore.
Yeah, yeah, of course. No.
Right. And what's nice about Quicksilver is he actually does give you different levels of detoxification. Like there's level one, level two, level three, I think, and where you can, really hit it hard, or you can just do some mild detox. Uh, the B minerals is also really good for that. It gives a mild detoxification in the cell on the cellular level, plus
Mhm.
giving your body the essential minerals that it needs.
With
Uh,
the push catch, actually, they recommended I wait. I can't remember how long it was, but it was maybe somewhere around 4 weeks post surgery. It
yeah,
wasn't like
that
they
makes
were they
sense.
were not recommending it take right after surgery. And you can always call these companies wherever you buy your detox kits and say, "What's explain? I'm having a mastectomy or a hysterectomy or whatever it is. Like, when should I be doing this? Because different formulas have different things, but I just don't think it's the thing to do right after the surgery.
No, no, you're into fragile state, I think,
Yeah.
post to do that. But yeah. Okay. Awesome. And then some alternative things, anabolic steroids, possibly nandrolone, oxandrolone, which you have to talk to your physician about. And they have to be knowledgeable, which would be very hard to find. We at Hormone Solutions, our doctors are extremely knowledgeable in them.
That's
Very,
awesome.
they will prescribe them. So, can be great for all types of arthritis, which I think is a real tip. So, and then the cerebral lysin, if you can find it, United States would probably be your best bet. Is if you're in the States, you'll be able to find clinics that offer IV cerebral lysin.
Hmm.
Did I miss anything? I think that's it. Zora?
There's one thing I would
Oh,
recommend
hey.
when you're in that surgery room and you're about to go under. I
Mm,
would what this is what I did, and I thought it really resonated with me and who I am. I looked at everybody in the operating room. They're all doing their thing. I tried to get attention a little bit, and I said, I just want to thank you in advance because I don't know if I'm going to see you again because there's like 10 people in the room. But I just want to say thank you for taking care of me. And you see the energy in the room change. You can see these people have busy lives. They've got kids, they got divorces, they got lives as well. And then it just sort of this little bit of gratitude to to just give to them. And I think that was really helpful. I had one friend actually who I told this to. She also had a hip surgery and she decided to buy gift cards from Starbucks. And she said, hip, hip, hooray, coffee is on me today, and
Wow.
passed out those little cards. And I thought that was really cute. So just giving a little gratitude to those people who are literally cutting you open, have your life in their hands. To me, it just, I felt like I gotta say something.
Yeah, yeah.
And so yeah, that was
They'll
just
just take
something.
extra good care of you if you're really nice to
Yeah,
them too, right? It's like,
just
yeah, show your gratitude and then they'll be extra careful with you, I would say.
yeah, yeah, make you feel better.
I love that. And everyone, you can find more about her journey and all these guests that we're talking about. And we've probably, you like me have talked to many of the owners of the companies that create a lot of these products that we're talking about that we love and use all the time, which we feel confident with sharing with our audience. Like, hey, these are things that we use and that we notice a difference by using them. So
Mhm.
that's all on your Hack My Age podcast. And of course, I've been on there many times myself.
Gotta go listen to those episodes.
And you have a
Yes.
really great menopause group. So share with everybody what that's about because that's great for biohacking menopause and it's
Yes.
definitely gaining traction. So tell us about that.
So yeah, so we have this community of women who are very like-minded, who want more than just, okay, let's wear layers now and get a fan. I mean, we have the hacks, and we talk about hormones and hormone therapy. We talk about all these crazy things that we just talked about now. And we have guest experts coming on every single week. And every guest that I invite to the podcast are also invited to speak in the community. So we have people who cost hundreds of dollars to have them as a consultation just for us. And our community is still small, so you get the attention that you need. And it's just wonderful. So we not only meet with me every week, I teach women how to breathe through menopause. I'm a breathwork instructor, and we answer questions live Q&As with me as well. But it's, I think one of the really special things is that we have our guest experts, but we also do these challenges, exercise challenge or sleep challenge, to try to motivate people to get into good healthy habits. And we have prizes and giveaways and things like that too. So come and join. It's called Biohacking Menopause, and I'll have a link for you in the show notes.
And she has a very active Instagram. So check her out on Instagram. What's your Instagram handle?
Hack my age. Everything is hack my age.
Everything's Hack My Age. She's always putting amazing content out. I follow everything she does and watch all of her videos because they're very educational. And I love it. And I love just watching you and listening to you. You're one of my favorite podcasters and speakers
Oh,
and just my minnow bestie. So thank you for coming on the show once again.
oh, thank you, Karen. And thanks everyone who's gotten this far and hung out with us.